Okay guys, today we're diving into something a lot of people are curious about but don't really talk about. Those weird side effects from GLP-1 medications. I'm talking about Ozempic, Wegovy, and Mounjaro, and yes, they're generics. The ones everyone's been hearing about for weight loss and blood sugar control. These drugs work really well for appetite, glucose, and weight management, but like anything that changes your body chemistry, they can come with some serious side effects. And I'm not talking about the usual nausea or mild digestive stuff. We're going into the weird, surprising, sometimes overlooked ones that you probably haven't heard about. And stick around until the end because I'm going to also cover some rare but serious cases that people should know about as well that are often swept under the rug.
Give me my 30 kilos back. I'll take that back any day as opposed to getting on that medication.
Let's get straight into this, guys. All I ask from you is just to hit the like button down below. It tells YouTube this is worth showing to more people. So if you like learning about health from a scientific perspective in a calm and collected way, consider subscribing too. So first, a quick refresher. GLP-1 medications are called glucagon-like peptide-1 receptor agonists. That's a mouthful, but basically they mimic a hormone in your gut that tells your brain you're full, slows stomach emptying, and helps control blood sugar. We've made videos about them in the past that did quite well. They're amazing for people with type 2 diabetes or for weight loss, but slowing your stomach isn't always smooth sailing as it turned out. We'll get to that in just a minute. But first, weird side effect number 1. Weird taste changes and food aversions. Some people report that foods they used to love suddenly taste off. Sweet things can taste too sweet, fatty foods can feel greasy, and some people develop an aversion to certain meats. This happens because GLP-1 slows stomach emptying and affects your gut hormones that communicate with your brain about satiety and food reward. Your taste buds aren't broken, it's your brain processing fullness signals differently. Weird, right? Number 2, reflux and acid issues. You might think, I'm just having heartburn, but some people notice that GLP-1 meds can trigger acid reflux, burping, or bloating in ways that are more intense than typical digestive side effects. This happens because slowed stomach emptying can increase pressure in your stomach and esophagus, which can push acid upwards. So if you have a history of GERD, it's something to watch closely. Number 3, changes in energy and mood. This one surprises a lot of people. GLP-1 meds can make some people feel a little foggy, fatigued, or even irritable, especially when starting the medication or after their dose increases. The reason for this? Appetite suppression can lower calorie intake and your body's adjusting to both slower digestion and lower blood sugar swings. So people feel less peppy until their body adapts. Number 4. Gastrointestinal timing issues you didn't expect. Yes, nausea is common, but what's less talked about is delayed digestion causing unpredictable bathroom trips or bloating. Some people notice that their digestion schedule is totally different. Meals take longer to move through the system, and you may feel full long after eating. It's science. GLP-1 slows gastric emptying, and that can feel a little strange if you're used to a regular routine of eating and going to the bathroom. Number 5, this is a big one that gets almost zero coverage. Changes in skin or hair. Some people on GLP-1 meds notice dry skin, hair thinning, or changes in hair texture. This exact mechanism isn't fully understood, but researchers think it's tied to changes in nutrient absorption and metabolism, plus the body adjusting to weight and calorie changes. This is usually mild and temporary, but it's something people notice and often don't connect back to the med. So what can you do about these weird side effects? First, don't freak out. Most of these effects are temporary, especially if you start low and titrate your dose slowly, which is exactly how doctors recommend it. Second, track your symptoms. Keep a little log of your meals, the timing, and side effects so you and your doctor can see patterns. Third, talk to your healthcare provider if anything feels severe, persistent, or impacts your quality of life. Sometimes adjusting your dose, switching the time of day you take it, or adding supportive strategies can make a huge difference. But now let's talk about the rare side effects people forget to tell you before you start taking them.
Now, if you take these drugs, there are some listed side effects like nausea, vomiting, stomach pain. But this growing list of lawsuits allege ugly and severe undisclosed side effects, including gastrointestinal injuries, even vision loss. Earlier on Morning in America, we spoke with an attorney for several plaintiffs who say these drug makers are not adequately warning doctors and patients of possible dangers.
And keep in mind, these are rare and not common, but good for educational purposes to know. The first is pancreatitis, which is inflammation of the pancreas. While uncommon, some people on GLP-1 meds have developed severe abdominal pain, nausea, and vomiting, which requires urgent medical attention. Secondly, gallstones or gallbladder issues. This is because changes in digestion can increase the risk of gallstone formation, which sometimes needs surgery if it's severe. And yes, there are cases of patients needing surgery. Another rare but serious complication is bowel perforation, which is essentially a hole in your intestine which leaks out food in your abdominal cavity, causing inflammation and sometimes sepsis. This is extremely uncommon, but it can happen if there's slow digestion and gastrointestinal stress combined in someone with a pre-existing gut condition. Finally, there's NION, or non-arteritic anterior ischemic optic neuropathy. This is a rare eye problem that can cause sudden vision loss in one eye. And while it's very uncommon, it has been reported in some patients taking GLP-1 medications, but might still be too early to find out if there's a direct link or not. The point here, guys, is not to scare you, but to make sure you recognize warning signs and find reasons to seek medical care immediately. Being informed about both the common and rare side effects is what keeps you safe while still benefiting from your treatment. If this video taught you something new about GLP-1 meds, go ahead and hit the like button down below or subscribe. It helps me know that you want more videos breaking down side effects and how these medications really work. And of course, if you have questions about GLP-1 medications, side effects, or how to manage them, drop them in the comments. I'll be reading and responding. Stay curious, pay attention to your body, and I'll see you guys on the next one.